So now let's talk about facial aesthetics. You might ask, why the dentist? Well, we have one of the best hands in medical space. We perform injections daily in the very small and dark areas. We perform precise injections. We're responsible for 3 most important aesthetic areas on patient's face: teeth, smile, and lips. We understand facial anatomy better than anyone else. So if you need to administer 0.5 cc of a bio-PRF with growth factors at exact landmark on your face, who else would you want to perform that injection? Now let's talk about PRP and PRF. Well, first, let's discuss how our body heals. So as we know, there are different types of cells in our blood. There's red blood cells that carry oxygen, white blood cells that help fight infections, and platelets. Very important cells are platelets. They help with clotting and regeneration. So let's say you chopping cucumbers in the kitchen and you cut yourself. What happens? Your hand will start bleeding, the blood will be exposed to oxygen, and the clotting cascade will start, which will signal the body to start healing. And the very important factors in the healing process will be platelets. So now let's just assume the person who was cutting cucumbers had diabetes. What does it mean? Well, as we all know, diabetics cannot heal easily. Why? Well, they have less blood flow, what we call microcirculation. But also they have a decreased amount of white blood cells and platelets, which are very important for fighting infections and clotting and regeneration cascade. So researchers had an idea of getting patients' blood using centrifuge to spin it around and divide it based on density, and getting concentrated white blood cells and platelets and inject in those areas to help patients heal. Patients who had trauma, vehicle accidents, aging patients who have just compromised microcirculation, or patients with a disease like of diabetes. So researchers began to draw blood from their patients, add anticoagulant, otherwise, as we know, blood will clot, and then use centrifuge that will spin the blood and will separate by density. So the red blood cells will go on the bottom and platelets and white blood cells will be on the top. So that way we can separate them, concentrate them, and inject in certain areas. This technology is called PRP, platelet-rich plasma. However, researchers were not done maximizing the healing potential. If you remember our example from the kitchen, the healing starts with clotting. And when researchers added anticoagulants, it prevents clot from forming. But it's really important because once the clot forms, that's what attracts growth factors and circulating stem cells. And this is what we want. A tremendous breakthrough happened when the new biomaterials were developed with the surface characteristics that prevent clotting, absolutely guaranteeing no clotting and safety. By using this technology, the blood could be collected without use of anticoagulants, 100% chemical-free. It could be collected using those special tubes that has surface characteristics preventing clotting. And the same way will be centrifuge, all the cells will be divided, and now we can inject them back into our patients, absolutely chemical-free, naturally using growth factors of our patients. This technology is called PRF, plasma-rich fibrin. PRF, plasma-rich fibrin, is a technology that uses your own healing proteins and growth factors to rejuvenate your skin, to help with the hair loss, to speed up the recovery. The recent studies show that PRF is 3 times more effective than PRP, making PRP an outdated technology nowadays. PRF stimulates collagen, helps tightening the skin, helps with acne scars, stimulates hair growth, helps with fine wrinkles, helps to remove fine wrinkles, rejuvenate skin. The goal of therapy with PRF is to offer an additional, safer modality to be able to regenerate your tissues naturally, as opposed to using dermal fillers or Botox. And of course, it will have more natural look. It's not going to look paralyzed tissue. It's not going to look unnatural. And a lot of patients of mine, that's what they want. They want to look like themselves, just 10, 20 years younger. Not all PRF created equally. The new BioPRF technology, the one that we carry in our office, is based on the horizontal centrifuge, and they produce much more growth factors because we have a better cell separation. Now, the easiest and the most reliable way of getting those growth factors into the skin will be microneedling. Microneedling relies on the fact that minimal tissue trauma boosts collagen formation and tissue repair. Microneedling with PRF is a very safe and effective way to resurface the skin with very low downtime, 24 to 48 hours maximum. In our office, we supplement microneedling with PRF with a laser treatment. The goal of the laser treatment is to send energy to the skin and stimulate collagen formation, which in turn has a tightening effect and younger looking skin. In our practice, we supplement microneedling with PRF with the laser treatments for facial aesthetics. The main goal of the treatment is to send energy into the skin precisely based on the wavelength to stimulate collagen formation, therefore making the skin tighter and younger looking.